hopefully tonight, if you're on the fence about one laser or the other, obviously we'll be a little bit biased towards the Remy, but but in actuality, this is what's so great about David is you're transparent all the time, David. You will go through the pros and cons of any laser, of any modality. And what I think is so awesome is that you've had your firsthand experience, you've had your hands on so many different types of lasers. So if there was anybody to ask these questions and get the pros and cons, whether it be the Remy laser or any other treatment for the lower extremity, you've got the right guy on the screen right now. So with that, I am going to go ahead and advance us along here. I just kind of talked a little bit about David's experience, but you'll find after tonight's webinar that this is the guy you want to talk to if you want to know about lasers. So David, do you want to talk about your history and lasers a little bit, and also shockwave therapy?
Yeah, I'll just give you a brief background of how the Remy, excuse me, I drank water and went down the wrong pipe. Anyway.
Of course, I ask you to start talking right when you're choking.
Okay. My first laser was a CO2 laser in 1984, and it only did warts. It cost me $36,000. It was a surgical laser. It was not a therapy laser. And the thing that it has advantages and disadvantages in that now today with warts, we can treat warts with no anesthetic, and we can and it's insurance covered. But my point is that I realized as time went on, you need a portable multifunctional laser, and that's developed over years of the various companies I've worked with. I started out with LightCure. I worked with K-Laser, which is now Sumis. I was a part owner with Aspen Lasers, Diawave, all these companies. I've seen it all, and I'm privileged that the Remy. I decided that in order to get a laser, not only does it have to work and be effective, you got to have a good return on investment. And that's really my whole philosophy. I've actually changed my philosophy in the last 6 months, maybe I'm getting older, is I only have two goals with my lasers. One is to give you great service, and two is to make you happy. It's the bottom line. Now, I also, at the same time, for the last 25 years, I have another company called Excellent Shockwave Therapy. I started out in the ESWT business, and I didn't know, Sarah, you wanted me to talk about shockwave. It's one of my passions. I could talk about it for hours. I started actually in the middle of ESWT, there's some good points that we'll eventually talk about. So over time, I've used the modalities. I feel I have the experience. There's no perfect laser out there. You always have a goal of trying to make it better and better and better, which is what I'm trying to do. And I'm always working on it. We're always improving. And the Remy today is not the Remy that was 6 years ago. It's Android. You can go from pain to fungus to warts, surgery, wounds, in 10 seconds. It's just tap a program and change the handpiece. So I feel very privileged that, I have this opportunity to present to you about the Remy tonight. And I'm looking for my phone. I want to shut the buzzer off. And to give this opportunity to my profession. I will tell you, and I'm not bragging, is the key to a laser success is working with someone one podiatrist to another. Unfortunately, I shouldn't say unfortunately, that's the wrong word. I don't know what it's like to practice. I only get experience today because I've been retired. I did hurt my eye about 12 years ago. I'm not asking for sympathy, so I haven't practiced in about 12 years. It ended my surgical career, but I'll tell you one thing. I'm the proudest I've ever been with our profession today. It's just amazing. I always joke when I get into podiatry school today. I mean, you got 3-year surgical residency fellowships. It's just amazing, the educational background and the intelligence and enthusiasm that I get to see with podiatrists. today. And that's what really keeps me going is it's the lasers are great, but it's talking to doctors every single day, talking about their practice and helping them with their practice. It's just not about lasers. It's about helping them be successful. And trust me, podiatry is alive and well. Trust me, it is.
And I just wanted to chime in really quick, David, because I love what you, when we get to a couple of slides ahead, everyone will see the criteria that you laid out, and like I said, 5-6 years ago with the Remy, but you've kind of transitioned. Not that those things don't matter, but that you're really, and it shows, your focus is making the physician and the practice, and obviously the end result of the patient happy. And I will say, if you take some time and go to remylaser.com and go to the testimonials page, I mean, none of those testimonials, all of them are authentic. They, and every single one of them talks about how great the equipment is, but there's always a mention of the support that David provides. And it's, to me, it's unparalleled, because it's astonishing to me that every single person who works with mentions that, and you wouldn't mention it unless you had to, because if the equipment is great and the team behind it is lackluster, that stinks, but you just wouldn't make a point of mentioning it. And everyone that works with David makes a point to mention it, because it's real.
Can I ask you a quick, oh, good. I'm on there. I didn't see if you got to see me.
Oh, yeah, we can see you.
I guess we can go to the next slide. Yeah. These are questions that I'd like to cover. I haven't seen these questions in a while. I will tell you, I haven't prepared for this.
I recycled a couple of PowerPoints for you.
Okay. Can I afford it? The answer is yes, and I'm going to tell you why. And that's because even though the quality of the Remy, it's first class. You got to realize I've cut out the middleman, or what you call the salesman, who there's a commission involved. It could be anywhere 30. I used to get paid 40% when I worked as a salesman. So I know what commissions are like. I'm not saying you didn't earn it, but if I can take that, this is a different world today. It's not where the salesman walks into the office and brings boxes of candies and apples or whatever and schmoozes. This is virtual sales teams. I mean, today with the technology that you can train, with FaceTime, Google Meet, you can train, you got videos. It's a different world today, and I'm happy for it. And the key is that it allows it to be affordable. If the Remy could be made, first of all, it's the only laser out there that's a class 4 510K FDA cleared laser that's multifunctional. And I'll give you one example. We'll get in this laser. I'll tell you something right off the bat. Can you afford it? Okay. It's not just the laser. I look for financing deals. I'm always talking to a lot of people. In the last 6 months, we have a financial arrangement. Listen to this one. And I think it answers this question. Can you afford it? I'm not saying you should finance, but if you did finance it, it's 0 payment for the first 6 months, $99 for the next 6 months. And if you finance it for a fixed rate, this is a bank, this isn't a broker, it's probably, I don't know, it's probably an 8 point something. You're talking about $350 a month, every month for 5 years. Now, why is that important? Because that's 1 case a month, which is, what's this? Snowy Highway. Oh, okay. There it is right there. And I'll tell you, it's amazing. So you got to have a laser that is effective. It's got to be multifunctional. It's got to be affordable to your patients. I always say when I'm doing trainings, don't memorize what I'm saying. I teach principles, but I've taught so many young doctors that are really, for lack of a better word, killing it. In lack of a better word, you can't have a $30,000, $40,000, $50,000 laser just does one thing, pain. I mean, you can, every practice is different, but you need something that has multiple revenues. But the key is it's got to be effective. And I'll tell you, the Remy is effective. Did we kind of skip out? Okay. So what happens if it breaks? Well, I'll tell you, the repair rate on the Remy is less than 1%. The repair service is in Florida. I have relationships. My repair center in Florida, We've been working together for like 15, 20 years. But the beauty of the Remy is you don't have to have somebody fly to your office. You put it, if most of the time it can be fixed. If it's typically it could be a software problem, it can be fixed right over the internet. But let's say it does need repair. Pop it in the box, we pick it up within 48 hours. If it's not fixed, we give you a loaner, because you can't be down. I mean, I remember being down and never calling somebody else and getting a machine, and I can't get a hold of them, and I'm down. You got to be, you know, this is the NFL. You got to be ready and have backups. How do you get patients to pay cash? I thought about this one. It's, first of all, this is not thousands of dollars. You know, a typical pain session, it could be anywhere from $50 to $100, or an office visit. But the beauty of getting patients to do this, I'm going to leave it with one. I don't want to get into too detail this, but I do discuss it. I can tell in 5 seconds when I do my trainings and look at somebody if they're afraid to sell. One thing about, it's not selling, it's education. The doctor is, the definition of a physician is a teacher. We're teaching them why it's beneficial for them to have the treatment. And I mean, I could go over examples, but the Eagles are on at 9 o'clock tonight. Well, they're in 25 minutes, so we'll continue. Well, I know how to use it. Everybody gets personally trained by myself, certification, CME credits, and it's not a one and done. Here's the manual. I work with you. It's a lifetime training. Should I buy new or used? Well, there are used lasers out there right now that are more expensive than Remy new. Now, so the answer is warranty is important, service is important, and having the confidence that if there's a situation, I'll give you a situation. We had a little power brick go bad. I had it in the guy's office in less than 24 hours, and boom, it was done. You know, and you know, those things are important. I mean, you can ship anywhere overnight, which is really great. And it's important. I want you to get service. Again, I told you, I keep my philosophy simple: great service and to make you happy. I'm not here to nickel and dime you with, you know, I'm talking to had a woman purchase a laser. And since the company's out of business, I'll talk about it. It was a Q-Clear, good laser. I helped bring it to the market. The company service was terrible. But the most important thing is they charge $7,000 to tune it up. And I'm like, that's ridiculous, because I know what it costs. I know what parts cost. You know, I'm not looking to make money off of accessories, make money off of, you know, service. There's very little service with the Remy, if anything. It doesn't have to be calibrated. I'm looking to make you happy. And that's why we have not one doctor, not two doctors, but a slew of doctors that have bought 2, 3, 4. I got one guy's got 15 lasers over 6 years. It's just like when you do a bunion. When you do a bunion surgery, when you do it so well that somebody else refers you another bunion surgery and another bunion surgery. The best way to build your practice is how? Make your patient happy and do the best damn job you can. And I have that same philosophy with the Remy. So what does 510K cleared mean? I just want to cover lasers. I'm just going to give you the layout of it. The Remy laser is 510K cleared, which means that it had to prove efficacy and safety and equivalency. When it came with the Remy is also a surgical laser. You can incise, excise, ablate. So all these had to be applied to the FDA. It's not just the laser, but the 510K. It's not. Well, it is if you're doing surgery for pain right now. They don't require. But I went through the highest level of 510K approval that you can get. All of my lasers are in FDA certified manufacturing plants. The FDA checks them every year. So these things are important. Whenever you buy a piece of equipment that they claim is FDA quote approved, ask them to see the ISO 1385 certificate. That shows that they meet the standards. And the word is thrown out there like crazy. It's you know, it's what's approval mean? FDA approval really means that it was a double-blind, randomized, placebo-controlled study. FDA cleared means that they met safety and efficacy. Registered meant that they applied and they provide safety reports. Next slide. So this has always been my philosophy. The laser must be effective. It needs to be multifunctional, where you can get a good short-term return on investment. And it's got to be affordable. A lot of these lasers that are $40, $50, $60, $70,000, it's the same price to the patient. You can't increase your price. You could, but they don't, because I know what the fees are out there. I mean, the fee stain. So you need to be able to afford, your patients need to be able to afford it. And the beauty of it, because I've been involved in the ESWT, which is not shockwave, which we'll talk about if you want to, where our procedures are $2,500 for one session, for one treatment, but it's a one and done. My point is that when you get higher fees involved, it's a lot more involved. Patients have to think about it. You got to get financing. You got to have a separate discussion. When you're talking lasers, you're talking hundreds of dollars and not thousands of dollars. But I teach you how to explain it to the patient like they're 5-year-olds. Another thing that's important is marketing. Unfortunately, that's how I met Sarah. Is she's done all this marketing for me. She's the mother of the Remy laser. I won't go down that road.
Well, you shipped me a laser, and then because I've been doing some photographs and such and videos of it, and it was so funny today. I was holding it and I was kind of carrying it around like a little baby. I'm very clumsy, and so I was like, I do not want to drop this like precious piece of equipment. But it's very good. I just wanted to hold it up because
I can't believe all these years you've never had a Remy in your hand.
No, and I've got it locked into the
You got the locks on it. So
I'm not gonna take it out because I've got it locked into the cart.
Yeah, well, here it is right here. I mean, it's 4 pounds, but I mean, over 7, 8 years ago, this particular laser was 30 pounds and it was a 30 watt. So, and only a single wavelength. And we'll talk about wavelengths if you want to also. So marketing is important. And I'll tell you something, I don't know if I ever told you this, Sarah, but I'm always offering this. Is that I tell everybody when we're talking about the marketing and the customization during the training, is that, doctor, you're the brand. And what does that mean? It's not the laser, it's you. We have videos. Sarah's put together videos, links to go on your website. But I like to see, there's only 2 ways a patient, marketing-wise, moves forward. One is they want to hear the doctor talking about it because they can sense the confidence in it. And 2 is they want to see other patients. So we're very willing, and there's never additional charge. You can do this 1 month after you buy the Remy. You could do it a year, whenever, as long as you own a Remy, because I like to see the doctor doing the video and talking about it. That's what's important. And it goes on your TV, your website. But we do have videos, which Sarah will talk about. But I think the most important thing, and it's one podiatrist talking to another one that has the ability to understand what it's like as a podiatrist to treat patients. So the support, the training is very important. I do all the training by myself 7 days a week. I enjoy it. You're my patients. Okay, I think we can go next slide. So what power lever makes the most sense for the foot and ankle? Would I need to increase power levels? It's a very good question. The Remy 30 4-pound is the most common one we use. It was really a full body laser. We do have a 45 watt laser triple wave, which is getting more popular, more popular, more popular. And I always, is one better than the other? If you're going full body, yes, the 45 watt. If you're doing shoulder, a knee, and multiple joints, you need it's a quicker, faster laser. It puts out what we call photons or joules of energy quicker. You get excellent results with both of them. The 45 watt is like a stealth fighter, but I'm doing something which we'll talk about later that I don't like you to have to base your decisions on the price. So I'll tell you a little bit about that later. Next slide. What's the difference between a class 3 laser and a class 4 laser? Power density, dosage. It's like a class 3 by taking an antibiotic orally. A class 4 is like giving IV antibiotics. Much more the whole key with lasers when we're talking about pain is it's power density. It's the amount of energy over a certain area over time, sustained energy to turn to go. Because, you know, an interesting thing, everybody says to me, well, how deep does the laser go? Nobody freaking knows. Nobody knows that, because every human body has a different density. Muscles are thicker. It's like a thin steak, a medium steak, or a thick steak. And the only way you can tell if you hit the right dosage by a clinical response. And I'll go into much deep detail when I train you on this, but you palpate. Let's say I have a lateral epicondyle, or well, we're podiatrists, plantar fasciitis. You press on it with either Remy. You treat the whole bottom of the foot for 5 minutes. I've set the time for 5 minutes. Goes off, you repalpate it. If they get significant pain relief, you're done. You've hit the right dosage. I always like, again, when I train, I do analogies. It's like if you have a dead battery in a car, you hook up the jumper cables, you charge the battery. If the engine starts turning over, you charge it longer. When the engine is running, you take off the battery cables, you're done. The same thing with this. You treat the trigger point, whether it's plantar fasciitis, Achilles tendonitis, Lisfrank's arthritis, any tendinopathy, arthritis, post-op sprain, strains, anything with pain, inflammation, and arthritis. I call pain in the ass and lack of mobility. But my point is, the only way you can tell if you've hit the right dosage is decrease pain on palpation. That's the most important thing. So that's the big difference, is the with efficacy. And it's been proven that class 4 laser is much more effective outcomes than class 3. Laser sizes. Does a small laser mean less power? Absolutely not. When you're talking about the Remy, you can get in these real small class 3 lasers. It's not the size. It's the ability to put out energy, comfortable energy. And it's very comfortable with the Remy. It's not real hot. It's very comfortable. It's an enjoyable experience. So you need to get high dosage. Remember, I said antibiotics. The Remy is like giving IV antibiotics as opposed to oral antibiotics. Okay, next slide.
Dr. Schaefer's biceps are bigger than the Remy.
Handsome devil there.
I never noticed that his arm was like, I think it's bigger than the laser.
It's true.
Okay, sorry.
Only Sarah would notice that.
I'm really adding a lot of scientific content to this.
I just read that's a big biceps he's got there. My God, flex.
Well, hopefully, yes. I don't think Dr. Schaefer's on this webinar right now, but we'll have to let him know.
I'll send him a copy of it.
Yeah.
Okay, next slide. Are there many modalities in podiatry to treat multiple conditions? What are they? I'm not aware of it. I'm not aware of any. They call Remy the Swiss Army knife of podiatry. I'm not aware of any device that does multiple things. There might be, but specific for podiatry, there may be ultrasound, laser devices, etc. But this is our bread and butter: warts, tendinopathy, fasciopathy, post-op wounds, warts. The warts, and we're doing poros. The warts has really impressed me. We've really got it down to, it's extremely comfortable now. Next slide. How does class 4 lasers compare to shockwave therapy for pain?
Or even ESWT, because I know you meant, obviously you mentioned.
Yeah. And my first brain thought was, what is shockwave? Okay, these terms are thrown around like they're meaningless. When I started, a shockwave was ESWT, and there were class 3 devices. In order to be called, I know this from experience because I did FDA work, and the FDA, this is what the FDA pointed out to me. If it produces a shockwave is where you get this pattern of high negative pressure, high up thrust, and low. It's like a EKG. What typically out there, when we're talking shockwave, they're talking about pressure wave devices. A shockwave is a device like I'm involved with Dornier. Dornier invented the whole industry, kidney stone lithotripsy. They call it orthopedic ESWT. It's a 1-session treatment. You need a local when you do this, or a nerve block. But the shockwave or sound wave goes into the tissue and it cavitates. It breaks up the tissue to create neovascularization. That's a shockwave machine. I'm not saying there's anything wrong with these pressure waves, but if you're going to compare the REMI to a shockwave pressure machine out there, the studies show you can use them together. The REMI has the long-term effects appeared, there's not a million studies on this, but the ones I've read, the REMI is the pain relief is much more effective and significant pain relief, and the REMI doesn't hurt. Shockwave hurts.
That's what I was going to mention.
You're limited in what you can do with it. Very limited.
We have the testimonial from Dr. Suzette Clemens, and her testimony was really powerful in the sense that she discusses that she has done the shockwave, but then she opts for the REMI most often because she says, she's like, I feel like it's almost inhumane to use this because it hurts so bad. And I didn't realize that.
Oh, it is painful. It is painful. So I don't know if that's clear on it. It's interesting. The companies out there using the FDA clearance for these, I'm calling pressure wave machines. They used my file 20 years ago that the FDA rejected. It was my idea to change the classification. So the price, I spent $500,000 on my first ESWT machine. Okay. And it limited, I hate exclusion. It limited podiatrists' access to the machines. That's why we had mobile companies. We had groups owning these machines. But that's a whole nother topic. But if we're talking about, we're not talking about ESWT. And again, when you're talking ESWT, there's low energy. There's one low energy machine that's multiple sessions. I think it's I think it's Storts. It's either Storts or I can't remember which one it is. There's 6 machines, and it's the first low energy machine. It's a low energy ESWT, and the physics proves this. You need a certain, like I said with lasers, you need a certain power density to get the photochemical reaction. You need a certain power density with a sound wave to produce a shock wave to micro trauma the tissue. And that's a whole nother lecture. If everyone wants to, if we get enough people, I'll be very happy to put on a lecture that I've done for 25 years on ESWT. It's a training that we still do.
Okay. Yeah, we could schedule that for 2020.
If anybody wants to call, if there's an interest, I'd be very happy to do it. Okay. Cool. So, but how do class lasers compare to CO2 lasers for warts? The REMI is a CO2 laser built in it. Okay, it doesn't use radio frequency waves, but it does cutting. It does excision, ablation, evaporation. It does cutting, and another thing it does is we have programs in there where you can treat warts, poros with no anesthetic. So we have different programs in there. CO2 laser was strictly a cutting device. It was terrible for fungus toenails. Terrible for fungus toenails. The one beauty of it was there was less pain. I don't know if there was less reoccurrence. The literature said when we cut out a wart, we numb it out, scoop it out, and do the whole base of it. And there was less pain because it did anesthetize the small nerve root endings. But people, we don't cut warts out anymore. But I'll tell you, the REMI right now is much better. We're talking about I call it for mosaic warts. No anesthetic. Takes about less than 2 minutes to do. It's anywhere from 30 seconds up to a minute and a half. But there's no hole, there's no bandage, there's no cutting. You're able to come in and leave. And results, I'm shocked with results. We have cases where they've had everything done. There's one case that a Dr. Ellsworth sent me. The guy was afraid of needles, and he gave up on treatments. He had everything but surgeon's warrant, canthrone, sal acid, all kinds of stuff. And we resolved it with a REMI treatment. Okay, next slide. So what is the average rate for a class 4 laser in podiatry? How long does it take to get a return on investment? The average person, and even during COVID, it was less than 6 months because it's multifunctional of getting a profit. It's not years, it's months. And every practice, there's always an exception. I have one particular doctor, I'll never forget as long as I live. I've had two, when we sell REMI laser, if you don't finance it, every laser that I sell gets a 90-day return. I've had 3 returns. Two of them bought him back. The first one was going through a divorce. There's a reason why I'm telling this. And he just wasn't ready for it. It was in Beverly Hills too. And he rebought it and he's off and running. The one guy lost his whole practice during COVID. So I just took it back. The third guy, it was in Cleveland. I'll never forget this. And I thought I knew the area. And, you know, he loved the results, enjoyed it, but his return on investment was very poor. And I never asked them because I thought it was a pretty good area in Cleveland because that's where I went to podiatry school. And I said, what, your office is gorgeous. How many patients you see? I see 3 a day. And I said, what's the area like these days? And he said to me, oh, we got about 1 knife stabbing a month. So he wasn't in a great area, but he actually, what got him through to pay it off was when I helped him finance it, where it really pushed it was psychological because, like I said, we put it was costing him it was a ridiculous amount of money per month, but I taught him the warts and that's what paid it off. And now he's getting, everybody goes at there's always exception, but everybody goes at their same rate. He's paid this laser off, in less than a year. You just got to, I always say to doctors, stop worrying about the money. It's a cash cow. Get out there and learn how to fix your patients and get them better. That's what the key is. If you're confident, the patient's going to be confident. They're looking at you through a microscope. They can tell in 2 seconds if you're the right person to treat them with a laser or with any treatment. Next slide. This is the Remy, the most common one. Again, the 45. I always said this is the Rolls Royce of podiatry. The 45 is the stealth. Now, one of the things I have done so that so you don't have to make a big decision, I've changed the price of the 45 watt, which is still inclusive, for under $20,000. So you don't have to make this big decision. But this is the 45 watt one. It's a triple wave. It sold for 25. I dropped it under 20 because I don't like you. It sells. I got to tell you, I never made it for podiatry at all. I made it because we do chiropractic. Actually, it's gotten real popular in the equine, treating horses, big animals. Again, because of the power density. And when you have a class 4 high power laser, you're able to cover more area faster and quicker. Like when we do the plantar fascia, we just don't do the fascia, the insertion. We do the whole foot because there's nerves inflamed. And there's no decrease in dosage when you do the whole foot. But my point is that I want you to be able to pick a laser out, not based on your budget, but based on your needs. But if I were to pick a laser out, it would be the 30 watt dual. We got hundreds of them out there. This is this one right here. They're all Android. This one's 4 pounds. The other one, it's 12 pounds. This one right here, let's stay on this one, right? This one right here is, you can take it on an airplane, pop it in your shockproof case. Believe it or not, it's in the NBA, NFL. They use them all the time. It's a powerful, portable, and it's affordable. It's not a cheaply made laser at all. It's got top quality in it. So I don't know what else. I think if you want to talk a little bit about the marketing, that'd be nice, Sarah.
Sure, absolutely. So, like David said, I have been involved with Remy since day one. I was lucky enough for David to choose me to team up with him on these fun, creative aspects of the laser. And so, we work with every single practice that purchases. David works, obviously, like he was mentioning, one-on-one with the training, and then it comes to me when you need your customized marketing materials. And we really will do, within reason, pretty much anything. We have a standard kit, and if you go to remylaser.com and check out the marketing toolkit, you'll see the templates are there online just so you can see what all is included here. Just a couple of examples of in-office posters, a little countertop display, but we do trifold brochures. We have advertisement templates that you can use for Facebook. We have handouts. You can use them as postcards. You could just use them as standard handouts in the office there at the reception desk. Appointment cards. We haven't done appointment cards. No one's requested those for a while, but when we first did the marketing toolkit, we did start with some appointment cards. We do have educational patient videos. I'm actually in the process of creating some new ones. I mean, we started this in 2018, and so David has taken the laser from it's a different laser than it was when it started. It's not completely different, but It's just constantly expanding in terms of its capabilities and its software and just its upgrades. So I don't think you mentioned, David, that the laser is Android based. So all the updates for anything as soon as it's on and connected to the internet, updates happen instantaneously. So it's not like you have to get a whole new laser for all the brand new
Oh,
all the bells and whistles that David adds to them as the years go by. But same thing kind of goes along with the marketing toolkit. We only had a couple of elements in the toolkit to start with, and it keeps growing. And when people ask for specific types of materials, we have practices that want specific FAQ flyers, or they like the trifold brochure discusses multiple conditions, but I can also throw in a brochure that is only about fungus. We had somebody request only about neuropathy and wound care. And so if it's really just about reaching out and on a little, David's a little bit better than I am. You got to stay on me a little bit. Sometimes I get,
for real.
I get a little overwhelmed with my inbox from time to time. So, but if you stay on me, I'll get you whatever you need. So that's never a problem. And that's also what makes the Remy an amazing tool for ROI, because it's already priced at an incredibly low rate in comparison to other lasers that don't even have all the capabilities that the Remy has. So it's the best price option. And then you've got an awareness toolkit that is going to get that ROI into your office faster, faster than it would be without these resources. So
I,
David's made it at your disposal, and I'm just here in the background to help.
I just want to point out something out. You talked about upgrades. The biggest upgrade that we ever did was, this is the pane. I'm going to show you the old versus the new. If you want to go from pane, of course, you change the program. And this used to be the fungus. It's actually an ENT handpiece for ears and nose. And we just changed it. Again, I just went from pane to fungus. And now we're always developing our attachments. Now it's a fungus with a zoom. Before we used to put fibers, you have to switch the whole operation to go surgical. Now to do surgical, and this has been the last at least 3 years, you just put this on. It's got a let me see here. It's got a little surgical attachment. This is this is the fiber optic right here. Before, we'd have to take everything out, change the whole setting. So I just went from pain to fungus to surgery, I don't know, 10 seconds. So it's real quick and easy and fast to move around with the Remy.
We do have a couple of questions that have come in, David. Do you want to go ahead and start doing some
Sure.
Q&A? Okay. I will say, you could answer it as well, David, but I'm just gonna chime in really quick. One says, can you go into the science of how this works? Obviously, David, you could do that for hours and hours and hours. The concept for tonight's session was kind of these overviews, but we have recordings. We have previous recordings of the science of Class 4 lasers, and I will send a link to you so that you can have access to all of those. David, I mean, you can do that all day, every day.
I could talk about it in 1 minute, because
Awesome.
in fact, I have a PowerPoint that I can send you. It talks about for hours about power density, and how the laser works. Whenever it's my opinion, I'm going to tell you, but this has been published for years. It's called photo biomodulation. It's where light energy gets into the cells, specifically the mitochondria, and produces energy called ATP. From that production, you get a cascade of events. And in fact, that's what I teach doctors. The first thing is decreased pain. You get decreased inflammation, lymphatic drainage, cellular repair, stimulation of the immune system. There's a whole cascade, but the most important thing when you're treating tendinopathies is decreased pain. That's why the only way you know you've turned on this chemical reaction is getting the right dosage in there. And the only way you can tell is by palpation. So if you press on the area pre-laser, it hurts. You treat it for 5 minutes and you repalpate. It's typically 5 minutes. It could be a little bit longer. If they get significant decrease on pain, you've hit the right dosage. You're done. It's not the time, it's the clinical response. But if anybody wants, you can always email. I got some great PowerPoints on it. So that's really, it's called it's a photochemical reaction called photobiomodulation. And it does a tremendous amount of things that it does with it. But that's really the foundation. All lasers were originally developed for wounds. It's amazing for wounds. In fact, I can show you studies. I went to OCPM, which is Kent State University right now. I have a paper that was done. It's amazing for wounds, whether it's venous, arterial, diabetic. They actually will kill surface bacteria, stimulate the photobiomodulation, and create a neovascularization. So it's, I have a lot. Every day I have a service. I get article after article after article. My dream would be with lasers is someday, remember, it's inflammation. If someday you're going to see, they can do this invasively. They put a fiber down your colon and treat the inflammation for colitis. Someday it's going to be for colitis, pericarditis. Right now I'm involved in 2 studies at Ohio State University and Alabama. Don't ask me why those 2. They're using it for post-traumatic stress disorder, anxiety, depression. The literature supports it, but this is one that's going to prove it through testings of the patients so that it can be proven. I mean, there's tremendous, it's the world that I've seen here. It's podiatry is always my favorite, and because I'm a podiatrist, but chiropractic, veterinary medicine. I treated a parrot the other night, a parrot. Okay.
I did not expect you to say that.
What's that?
I just didn't expect you to say that.
I know I did a little. It was a veterinary. It was actually referred by a podiatrist. The woman, this vet was in the podiatrist's office. She fell in love. She had plantar fasciitis done. And she says to me, I met my podiatrist helped my plantar fasciitis. I know they have lasers for vets. And I find out she's a parrot specialist. And I'm like, okay, let's do it. And the joke is I'm going to ask her to have the parrot sing, "I love my Remy." I'll get that video, I promise you. I'm working on it. But it started in veterinary medicine. It's wherever you have human or animal tissue. And that's another thing I want to point out. Lasers post-op are amazing. Decreased use of narcotics. I can show you a study. Right at the time of surgery, they used a laser, and it was a tibiofibular internal fixation. It was an open wound, open compound fracture. And they used the laser. It didn't get rid of the use of narcotics, but it reduced it dramatically. You get better wound healing, less chance of infection. So all lasers were originally developed way, way back for wounds.
All right. Ready for the next question?
Sure, why not?
When billing laser code 17110 for destruction of lesions, if you do it every few weeks and it takes 6 treatments or more, how do you justify to insurance companies using a destruction code over and over again?
Well, when we're using sal acid, if you look at, there's no specific code for laser therapy. Okay. How do you justify it? Well, that's pretty the standard. If you use sal acid and if you use canthrone, it's the same thing. The advantage is that there's no acids in canthrone and it's better for the patient. So how do you justify it? Well, that's what the CPT code. I don't believe that you should use a CPT code because you think it fits. I know that that's the code they want to use because whenever you're looking at a CPT code, look up the medical necessity guidelines for the insurance company. It's what the guidelines show versus what you think it is. Obviously, you don't want to do 50,000 treatments, but I think anywhere between 1 and 10, it's an average of 3 treatments. You document it. The global period's every 10 days. It's a good question, but it's a question that, to me, it's they don't differentiate whether you use sal acid. I've used sal acid for a year on a patient. Okay. you better have a good reason today why you're going to use it. You would think, that if you would think, obviously you don't want to rush the surgery. You could just, if some practices, I used to just numb it up and cut it out. That's what I did in my day. But that's a whole new world. Patients don't want that thing. They don't want a needle stuck in their foot. But I think it's very reasonable, anywhere from 1 to 10 treatments every 10 days, as long as they're improving. But it's all based on medical necessity, and proper documentation. I'll tell you a very interesting story that happened the other day. Was a podiatrist is telling me that there's another device out there that's non-covered. I don't know if you're allowed to mention, and he's actually getting threatened by the insurance company because they say it is covered. So I'll tell you the solution. Get out of insurances if you can. I don't know how you do it. I just don't know how you do it. In my day, we used to complain and bitch, but it's real today. You're bitching and it's real. So you want to kind of move towards cash paying service. And that's one thing Remy does. It's a great starter, reasonably priced, multifunction, where it gives you the opportunity to move away from cash services, or at least try to get in the game. You got to get in the game and play. You're never going to win. They say Michael Jordan was the greatest shooter of all time. He also missed the most baskets of anybody. You got to shoot the ball, and the Remy gives you that opportunity. So I hope that was a good an answer. I wasn't trying to avoid it, but it's an interesting question.
I know, well, maybe I don't know. I'm just gonna let you answer it. Is the Remy available in Canada? And if yes, is it Health Canada approved?
No.
Yeah, that's what I thought. So I wasn't wrong. Okay.
Yeah.
All right. How does the laser differ from the MLS laser in efficacy and cost?
Okay. Efficacy, nobody really knows. I have tremendous testimonials that say it's over 90% effective. I will tell you the analgesic effect and immediate pain relief is much higher in the Remy than it is the MLS. I'm not saying it's a bad laser at all. And I was thinking about this because I thought I would get comparisons. I don't want to badmouth any company. When you go on the road, some people are driving Fords, some people are driving Buicks. Everybody has their different tastes, so there's plenty for everybody. I personally would not buy an MLS. I don't think, because I used to buy everything in the world just to try it out. But cost wise, the you could have 5 Remys for 1 MLS. If that helps you. But the main feature, what makes the Remy different, is the Remy is a multifunctional laser, multiple streams of revenue. You just can't buy a pain laser, a fungus laser, and a wart device. It's all in one. I learned that over the years. You can't do that. It doesn't make economical sense. I've had people invest over $100,000 in lasers where, they just had to get rid of them because it's not affordable. And you can't put multiple lasers. One thing with the Remy is you can get one Remy and move it around. People don't do that anymore because it's so reasonably priced. But you can't, if you have a laser like an MLS or any heavy, believe me, I've had these lasers, a technician has to fly in to repair it. Okay. Everybody, you can't move the laser around if you have multiple offices. And I'll tell you another thing that's interesting about unattended lasers or robotic lasers. The Remy takes about 5 minutes. You still have to have somebody set it up, do the treatment, and leave. I personally like hands-on. There's many ways to skin a cat, but it's the efficiency of patient treatments is much higher than the Remy, than any robotic or stationary laser, because it's fast, quick, because it's high dosage. It's 5 minutes. I've been told it can take anywhere from 5 to 25 minutes with a robot, with a MLS. It's because it's a low powered. I think they're coming out with a high powered laser this year. I wonder why. But anyway, everybody has to make their own decision. I always used to say, if I woke up in the morning and would I try an MLS laser? Sure, I would. I had 2 in a clinic. It does work. I'm not going to say it doesn't. I worked in a clinic where a chiropractor was there, The unfortunate problem was he was seeing a lot of patients, and we had all kinds of breakfasts, and I helped him with it. And then one day I sat down and looked at his books, and he wasn't making any money. So just because you have a lot of volume of patients and the practice is busy, you got to be a business person. You got to make sure your return on investment is there. You can't fix your mistakes so easily as the future. And that's why with the Remy, everybody gets if you don't finance it, you get a 90-day return, because I don't want you unhappy. I don't want it to sit in dust. I want you to use it and do well.
Yeah, I think that just based on what I know from your client base and the feedback that they give is, like you said, you can buy a handful of Remy's at the cost of one other laser. And I'm wondering if you could provide a little bit of clarification on this, David. Obviously, like you mentioned, there is the Remy FX, the Remy 45 watt. I believe I may be wrong. The MLS is a high power laser, and again, okay. Is it necessary for the foot and ankle? Because the Remy standard is our 30-watt laser, and it's like we just did the profiles of excellence and PM and podiatry management journal. It just fits podiatry like a glove, and because of the size, the power levels, the amount of capabilities, and the cost. It's like it's not because I'm biased. I just don't see another laser that fits podiatry so well.
I agree. I agree. But I'll tell you another interesting thing happened is that warranties are important. The Remy's a 5-year warranty. If you need it fixed, it's picked up, overnighted, and repaired. The warranty, if I last remember, I think it's 1 or 2 years, and after that, it's $2,500 a year. You can't charge $50, $60 a visit and have that type of laser there. You can't do it. It doesn't work.
We have 2 other questions that came through, David. I think you'll probably be able to get through these ones pretty quickly. Does the laser kill warts with heat? And then what are the long-term results for fungal nails?
Good question. Okay. The way it works for warts is and this is proven, lasers stimulate the immune system. So it's the immune system, and we're talking about non-anesthetic, and it coagulates the capillary bed. That's how it works. And what was the long-term effects with that's a good question. And the answer is, I don't know of any studies long-term showing you're not going to cure fungus. You're not going to do it. The whole goal when I train doctors is, why are you treating fungus toenails? It's to reduce or eliminate the need for oral medications. That's why we've invested in the laser. Oral Lamisil, which I loved in my day. I'll tell you what I didn't like about it. It doesn't kill the liver. That's another story, and I can prove to you why by telling you a story. But I had 2 serious allergic reactions that were hospitalized. But in the line study with oral Lamisil, it was 50% reoccurrence the first year and 75% in 5 years. I don't know of any studies like that can actually tell you that answer with lasers. But what I can tell you is that it's more. It's not your fixed. I always like to give the analogy of dentistry. You get your teeth cleaned, you get them whitened. If you eat, drink, or smoke, it's going to come back. That's why patients need to be educated in that when they have fungus, once we get it under control, you're going to need to come to me like your dentist to get it, to treat it, to evaluate it, so that it can't get back to where it is. But I would imagine there is no study that I'm aware at all. And in fact, the only study I've ever seen was with oral Lamisil. I don't think any of the topicals, that are out there, even the ones that are prescription, have an answer to that. So the answer, if a patient asked me that question, I'd say it's an infection. It can come back. Fortunately, we can retreat it again, but I'm going to show you how to prevent it from coming back. Fungus is tough. I'm going to tell you something. It's a tough condition. I always say, if I'm in room A treating pain and you're in room B treating fungus, I'll triple the practice, because fungus takes time. I'm not saying you shouldn't treat it, but it's something you have to have patience for. Why do I know the Remy is effective for fungus? I can show you pictures. We have the studies. We don't have nobody has long-term studies that I'm aware of. But I have doctors coming back buying 2, 3, not 1 or 2, lots of doctors coming. You don't buy 2 or 3 lasers over a period of time for just fungus toenails if it didn't work at all. I have some doctors charging $1,200 for 3 treatments. I got a few charging $2,400. Again, there's no double-blind randomized placebo-controlled studies on lasers. There are for pain, but there's none for fungus.
So I did just send a link with that question about the warts to our previous Practice Partner Academy from several months ago, which was specifically about treating warts and IPKs with laser therapy that gets really more in depth into that treatment. But like you mentioned earlier, we have so many webinars of you talking about the science of just laser therapy in general, and then the science of these individual protocols. On remylaser.com, we have an interview with Dr. Dunetz about toenail fungus. We have, well, if you go to the Practice Partner archives at podiatrymeetings.com, you'll find more lectures with Dr. Zuckerman. And then if you go to the laser chat page on remylaser.com, there's a lot of information there. So if you do want more information about the scientific portion about just whether it be class 4 lasers in general or specific conditions, please reach out you can reach out. Let me put that, let me put your slide back up here that has your contact information. And then we'll get wrapped up here. So David has to watch his Eagles play football tonight. But no, we're wrapping up anyhow, but let me just get that up so everyone has that information. Share.
If anybody has a question, I'm very happy. They can text me. I can talk to you on the phone. If I don't pick up, it's because I'm training.
Right.
But I'm always happy to answer any
questions. Am I showing that? Is that
I got to tell you something interesting. We just had a case by a doctor where a patient had RSD, chronic swelling, lack of motion, no motion in the Achilles and the ankle, 3 treatments. You couldn't even cut her toenails. That's how bad it was. And she's now on her way to recovery. And it's that's the good part. The sad part is that the insurance wouldn't cover for an additional epidural. That's the sad part.
Oh, yeah, it's crazy. Well, insurance, right?
Insurance.
We'll just leave it at that. But well, that wraps up all of our questions. David, thank you so much for being here tonight. We appreciate it. We had a solid amount of people with us this evening, and obviously it's no fun if we don't have people show up. So thank you so much for being here. Again, this is David's contact information: call, text, email. You can also check out remylaser.com for a ton of content. But if there's something specific you're looking for, I think David is the best at getting back to you with the information quickly. So don't hesitate to do that. But we will be, Ann and I know Ann's not here with us this evening, but we will be in touch via email. I know you always see us in your inbox, so hopefully we're not bugging you too bad. But we will keep you up to speed on our 2024 Practice Partner Academy schedule. Dr. Zuckerman is joining us again next year as a valued partner with podiatrymeetings.com. So we appreciate that. And I hope if you are on the fence about laser therapy, tonight gave you a little bit of clarity. And again, I just don't think there's a better laser for podiatry than the Remy. And that's not because of this webinar. It's just because it's true. So David, did you have anything you want to close out with, or are you good?
No, I'm happy, and pick out the hoodie that I sent you.
Oh, yes. David has got me a nice Christmas present. So I'm very excited to do that. So I'll have to get offline and go shopping. So, all right. Thanks so much, everybody. And we will be in touch with our next presentation. And until then, happy holidays. Bye.